Good morning, friends. Today we will going to discuss regarding replacement fluids. Simple substitute for transfusion. Only normal saline or sodium chloride or the balanced salt solution that have a similar concentration of sodium to plasma are effective replacement fluids. These should be available in all hospitals where other replacement fluids are used. Replacement fluids are used to replace abnormal losses of blood, plasma, or other extracellular fluids by increasing the volume of the vascular compartment. They are used principally in management of patients with established hypovolemia, example, hemorrhagic shock. Maintenance of normal volemia patient with ongoing fluid losses, example, surgical blood loss. Intravenous replacement therapy are first-line treatment for hypovolemia. Initial treatment with this fluid may be life-saving and can provide some time to control bleeding and obtain blood for transfusion if it becomes necessary. Crystalloid fluids, crystalloid replacement fluids, contain a similar concentration of sodium to plasma, but it cannot enter the cells because the cell membrane is impermeable to sodium. Pass the vascular compartment to extracellular space. Normally, only a quarter of the volume of crystalloid infused remains in the vascular compartment. To restore circulating valve volume, intravascular volume infused crystalloid in the volume at least 3 times to the volume lost. Dextrose or glucose solution are poor replacement fluids. Do not use them to treat hypovolemia unless there is no other alternative. Colloid fluids. Colloid solutions are composed of suspension of particles that are larger than crystalloids. Colloids tend to remain in the blood where they mimic plasma contains to raise the colloid osmotic pressure of blood. Colloids are usually given in the volume equal to the blood volume lost. In many conditions where the capillary permeability is increased, example trauma or sepsis, leakage out to the circulation will occur and additional infusion will be necessary to maintain the blood volume. Points to remember: there is no evidence that colloid solution have advantage over normal saline or balanced salt solution for resuscitation. There is evidence that colloid solution may have an adverse effect on survival. Colloid solutions are much more expensive than normal saline and balanced salt solution. Human plasma should not be used as a replacement fluid. All forms of plasma carry a similar risk as whole blood of transmitting infection such as HIV and hepatitis. Plain water should never be infused intravenously. It will cause hemolysis and will probably be fatal. There is a very limited role for colloids in resuscitation. Safety. Before giving IV infusion, check that the seal of the infusion bottle or bag is not broken. Check the expiry date. Check that the solution is clear and free from visible particles. Maintenance fluid therapy are crystalloid solution, such as dextrose or dextrose in normal saline, used to replace normal physiological losses through skin, lungs, feces and urine. It is unanticipated that the patient will receive IV fluids for 48 hours or more. Infuse a balanced electrolyte solution. Example, potassium chloride with dextrose, but follow the doctor's order. The volume of maintenance fluid required by the patient will vary, particularly if the patient has fever or with high ambient temperature or humidity. Wind losses will increase. Other routes of fluids administration. There are other routes of fluids administration in addition to IV route. Oral and nasogastric administration. This route can often be used for patients who are mildly hypovolemic and for the patient who can receive oral fluids. Oral and nasogastric administration should not be used if the patient is severely hypovolemic, if the patient is unconscious, there are gastrointestinal lesions or reduced gut motility, example, obstruction, imminent surgery with general anesthesia is planned. Rectal administration. Rectal administration of fluid is not suitable for severely hypovolemic patient. Advantage of rectal administration include it allows the ready absorption of fluids. Absorption cases and fluids are ejected when dehydration is complete. It is administered through a plastic or rubber enema tube inserted into the rectum and connected to a bag or a bottle of fluids. The fluid rate can be controlled by using IV set if necessary. A safe and effective solution for rectal rehydration is 1 liter of clean drinking water to which teaspoon of table salt is added. Subcutaneous administration. Subcutaneous administration can occasionally be used when other routes of administration is unavailable, but this method is unsuitable for severely hypovolemic patients. Sterile fluid are administered through a cannula or needle inserted into the subcutaneous tissue. The abdominal wall is a prepared site. Solution containing dextrose can cause tissue to die and should not be given subcutaneously. Thank you for watching. I hope you learned from this topic. This is a brief information gathered from any different sources. If you have any additional information, you can comment down below. Thank you and God bless.